In side lying, we're going to test two things. One is hip abduction, strength, and stability. So we'll grab the leg, pull her into extension. The bottom leg flexes so that her base is stable. We're going to bring her lined up with her trunk. We're going to look at core, what's going on at the core, what's going on the hip. Is she anterior dominant, quad dominant, or tensor fasciae dominant, or is her glute medius work properly? So we're going to bring her into position and we're just going to hold there. This is a basic hold test. Does she hold? Does she stabilize at her core? Does she get solid at the pelvis? And if she does, then we can do a manual muscle test grade to test her strength, endurance of her hip. Bend your knee. The other one, let's go ahead and flip on this side for me, is basic lateral abduction external rotation, also known as clam. We're also going to look at the core. We're going to ask the patient to come up to about 60 degrees of flexion and gently bring the knee apart. Does the hip, and we're going to go through it, this is efficient. She's going to draw on her core and she's going to outwardly rotate and abduct. Does the hip rotate in the center of rotation? The axis of rotation back down. Now if it's inefficient, which it often is, go ahead and show an inefficient pattern. Quite a bit of trunk motion and the pelvis rotates and shears posteriorly and the hip doesn't stay in the center of rotation. It slides backwards. Come on back down, let's go through real time. Go ahead. More efficient and less efficient. Good, that was very inefficient. Let's do what an average patient would do. There you go. A lot of what we call wobble in this area, and not the deep rotators and the glute med that we're looking for. So one more time, let's finish up with an efficient pattern. So tightening of the core, slightly lower range of motion, and then down as the hip spins in the acetabulum. Thank you.